Assalamu alaikum warahmatullahi wabarakatuh. Good afternoon, everyone. I am Engineer Ayan Osman from the College of Engineering at Banadri University and also member of One Health Somal One Health Center in Abra University. So I'm going to share with you this study of assessing the hospital waste management practice and the environmental impact, a One Health perspective on Mulago Referral Hospital. So during this presentation, I'm going to cover with this interaction and the objectives, material and methods, the results, and also the recommendations in this study. Thank you. Firstly, the hospital waste management is a critical aspect of the healthcare delivery with a significant implication for public health, environmental sustainability, and the overall community well-being. And also the developing countries, known as the low and middle-income countries like Uganda, they have the healthcare infrastructure is very poor, and also the resource may be limited. So the hospital waste is dangerous to the environment, and also it poses many risks to the public safety and also the environment. It causes many environmental impacts. This particular type of garbage, means the hospital waste is quite harmful. It may contain heavy metals, or its pollutants or contagious materials. Additionally, the general public and the workers in the waste management are more vulnerable due to the diseases caused in medical wastes. But almost of all the issue arise during the final stage of the management of the healthcare facilities, as well as during the techniques for sorting, different processes like sorting, collecting, packaging, and also storing, transportation, and treating. All these processes are very important to be managed very well. So the main objective of this study is to ask the current hospital waste management practice in Mulago Referral Hospital from One Health perspective. So the specific objective is to determine and characterize the quantities of waste generated in Mulago Hospital, and to analyze and determine the properties of wastewater being released directly into the environment, and to assess the waste management by using individualized rapid assessment tool, and also to propose an effective waste management system for Mulago Referral Hospital. In material method, first the study area. Mulago Hospital is a national referral hospital, and it's the largest hospital in Uganda, located in the capital city, Kampala, and it serves as a teaching hospital in Makerere University College of Science. And this is the oldest and the largest hospital in Uganda. It's established in 1913. So the data collection, by using the determination of type of waste produced and the quantity in each category, and also the properties of wastewater released into the environment, and the waste management patterns at Mulago Referral Hospital. The waste management system studied was how was the generation of waste, and also the process of collection, storage, transportation, processing, disposal. The method used during this study was the physical observation of all the wastes, and also the interviews taken from the medical waste workers using individualized rapid assessment tool, and also the analytical method is by taking a sample from wastewater and testing it. So this data were collected in 30 consecutive days from 14 September to 13 October in 2022. The collection performed by the Mulago Research and Ethics Committee. The solid waste generated within 24 hours were collected and were collected and also stored in somewhere in the hospital. During the storage of this waste, they were used the open dumping, as we see in this picture. This picture I captured from the area they were storing in the waste. If we give a look in this picture, the land, it's open dumping, and it's not designed as some storage of waste, exactly with particularly a medical waste. The land has no coverage, or it may be caused contamination of soil and also the groundwater. After this, and there was no separation at the point of generation in the waste. After they collect the waste in this position, they use these color-coded containers for separating the waste in each category, and then those were used for the different categories of the waste, and those packets were used for syringes and also some medical critical wastes like heavy metals included. During the sampling techniques, simple random sampling used to select the open channels and exact position for wastewater sample collection. The purpose sampling were employed to select the respondents for filling out the audit checklists, and individualized rapid assessment tool were used to aid the filling out audit checklist. This rapid assessment tool is a tool used for hospital waste management. Both sampling techniques utilized to ensure the representativeness and the research process. So the wastewater that sampled, the property of wastewater was tested with the zinc content, also a lead content, nitrate, nickel, and the total chromium content, mercury, platinum, pH, and the BOD, COD, and the E. coli, and total coliforms. So the result in this study was within this 30 days period, it was established 72% of waste, of general waste within Mulago Hospital was general waste, and also 28%, which is 930.8 kilograms were clinical waste, as shown in Figure 1, the composition of waste generated in Mulago Hospital. The quantities of waste generated, this is the x-axis in general composition of waste, and the y-axis showing the weight of each category of the waste. In general waste, the food items were calculated to have 1,010.6 kg, while the cardboard was 79.1 kg, the papers was 73.1, rubbers for 268.1. The plastics was 555.8 kg. The others were 424.5. While the clinical waste was shrubs, it was 623.3 kg in the all 30 days. The anatomical waste was 93.8 kg. Pharmaceutical waste was 85.5 kg. And the waste contains the heavy metals was 15 kg. And also the chemical waste was 16.1 kg. The others were 97.1 kg. And this is the quantity of waste generated. There were different units of the hospital. The operating theater was generated in 30 days, 609.4 kg. The wadis were generated in 1,602.8 kg. The public areas were 382.5. So this is the sorting method in different units of the hospital. The operating theater was 62.8%. Wadis were sorted in 27.3%, while the public areas was 25.6%. Administration was 51.7%, and the laundry was 25%. The conclusion in this study, Mulago Hospital waste is mainly consists of general and in low percentage being was infectious waste. Waste is not sorted in a generation point, leading to the risk of the waste varies during the sorting, restriction in the number of business within the facility and the visitor items could significantly reduce waste quantities. Utilizing the individualized rapid assessment tool, Mulago Hospital waste management was scored at 62%. It's somehow fair performance, but it's not very good. Still, the maximum allowable level it was the zinc, nickel, chromium, mercury, and E. coli, and coliform and pH were met. But the lead content and nitrate content, and also COD, BOD, it's exceeded the allowable limits, comparing to national and international standards. So to manage waste effectively, Mulago Hospital should provide appropriate waste containers to prevent the mixing and spillage. As an environmental engineer, I suggested some designs for containers that may be suitable for different wadis to both. So this is the recommendations I did after this research. It's a regular stakeholder training and the capacity building required for all Mulago hospital workers. Hospital waste management currently is primarily handled with the waste management team. The active participation of the other stakeholders like nurses and doctors crucially for efficient waste management, and importance of the waste separation at the generation point emphasized, and also the awareness needed among the waste handlers regarding to the vaccination for all team in hepatitis B or PEP for a case of exposure. In case of exposure, it measures the necessary to ensure the all generated waste in the channel to septic tank for the proper handling, and existing open channels is conveying the wastewater should be closed and connected to septic tanks due to the properties exceeding in the permissible levels to disposal to the environment. Okay, thank you.